Today I was very fortunate to get to use one of the machines and have my own eyes tested. Thankfully the results seem to be okay. What that highlights is technology's moved on to be able to look deep into the eye and identify issues that perhaps aren't even eye health, might be something deeper and more worrying than that can be predicted now much more in advance.
One of our biggest barriers, and it was nice that we got to raise it with the MP, was actually having a MECS service, or the lack of. Although we have the facilities and the equipment and the staff who have already got the accreditation to do so, it seems like a barrier that is not needed. So in the eyes of a patient, it's just another restriction for them to not be able to come and see us, and an inconvenience for them to go to maybe hospital or secondary care when not really always necessary.
It's the purpose of these visits, to be honest, because often you get told stuff that's behind the scenes that you're not always aware of, where you get a real sense of the reality of issues and the good stuff as well you wouldn't normally be told about.
GP may not have the kit or the facilities to see the patient.
Yeah.
The GP would then refer onwards to hospital, which is also expensive and also not always convenient for, let's say, an elderly patient who has to then travel a lot further to go to their main hospital, whereas their high street is always available. So we execute that very well. And in fact, in COVID, when the hospitals were really restricting who they could see, we still could see them for those emergency care needs, because we had the facilities to do so, both equipment and also the staff and the expertise. But it's a shame in Watford we don't really have that, and that's something that we've been trying to kind of raise behind the scenes, but it's quite slow.
I'm glad that you raised that.
I think the reality is we've piloted it in our previous stores, even from scratch. So we've moved from East London and in those stores where there wasn't a contract, we've piloted it and worked on what it might look like. Patients came in, they enjoyed the service and actually found it a lot more convenient, and it actually saved a lot of money. Really, the case is there for, in the eyes of the patients, if it's more convenient and easier for them, then we're less likely to miss more important diseases, we're less likely to miss certain things that might need acute care, and if we can look after them in a more simpler format, we're actually helping the longer term picture of a patient not disrupting the hospital care and taking up maybe space where someone with more urgent needs can be seen. So there's a bigger picture here that in the hospital the other patients are missing out.
I think it's really important for anyone who's in a role to make decisions about the country or local issues and so on, to actually quite rightly meet as many people as we can, to have those conversations. It's been great to visit Specsavers today. They're a really important part of our high street, and chatting to the team here, you can see the passion that's brought into the role, into the work that they do, but also what's really at the heart of this is the community. And I think when you look at the role that they play in the community, our eyes and ears in particular are so important to us, making sure that we're supported, and especially for people who perhaps are the most vulnerable or at the most vulnerable point, being able to come in and hear a friendly voice, see a friendly face, to be able to help them and advise them, I think is absolutely essential. And so for me, I love doing these sorts of visits. I do them all every week, all year round, because you get so much value from them, and it's great to see the fantastic work that's being done.
I think the main thing is being locally run and operated, showcasing what we do in the town of Watford. The MP gets to see what we do as an employer, gets to see how we look after people's sight and hearing firsthand, and also just see how our operations run, because from the face of it, I guess someone might see an optician's but not know the behind the scenes of what we do in terms of care, referrals, or looking after eye health, really.
I mean, I try and be out and visible and as accessible as I can, but I can't be everywhere. So having these sorts of visits means that I can build those relationships and continue those conversations. There were a few points raised today that I'm happy to bring up and move forward with and sort of raise as points to try and get some action on as well. But I think really it's about that sense of cohesiveness. I've often said that MPs aren't, and definitely not me, I don't live in an ivory tower. I'm on the streets, I have to get my eyes checked just as much as anyone. So actually the reality is being able to bring that humanity and that sort of human real life stuff, as it were, to what we do is absolutely essential.